and welcome back to my channel. I am Cindy, your pharmacist, and this is Health Talk TT. This is a channel where I share health information, drug information, and aspects of my career as a pharmacist. Now, today I want to conclude on smoking. Last two episodes I touched on smoking, tobacco smoke, and how its toxins can affect our body. And I also spoke about secondhand smoking because generally persons who are not active smokers may not understand the extent of the risk that is involved with them being secondhand smokers. So we spoke about that, and then in today's episode I want to talk about the disease states that cigarette smoke could result in, or the risk of disease states that you have. It's outside, and I would have mentioned this in one of the videos before, it's a lot more than just lung cancer. So generally, and for a long time, when persons hear about cigarette smokers, what we attach to them is lung cancer almost immediately. Have you ever heard before somebody say, so and so smoky whole life, and he dead from a stroke, not even cancer, it's a stroke he dead from. I don't know if you've ever heard that before, but I've heard versions of that on multiple occasions. And today I want to talk to you about what exists beyond lung cancer as a risk for those of you who smoke. So let's start with the realm of cancer because that's what's probably most familiar. So not only would you be at risk for lung cancer, but what if I told you it goes beyond that? What if I told you you're at risk for oral cancer? You're at risk for kidney and bladder cancer. What if I told you you're at risk for gastric cancer as well? Because if you understand where the fumes go when they travel, they don't just jump from your mouth straight down to your lungs. It's going to pass through the beginning of your gastric system, your throat and stuff, and before it hits your lungs. And because of that, you can also be at risk for gastric cancer. So that's cancer, and there are other forms of cancer. I'm just trying to touch on the most common ones, or the ones that are most familiar to the majority of persons. Beyond cancer, what about cardiovascular disease? What about high blood pressure issues? What about heart attacks? What about heart failures, strokes? We don't naturally or commonly associate cigarette smoke with these lines of disease. Usually we just assume that if we are diabetic, if we are hypertensive, if we have heart issues, we probably shouldn't smoke. But do we know the extent to which cigarette smoke really does increase the risk of these disease state? And should we be surprised if a chronic smoker dies from a stroke eventually? Because it would have been umpteen years of that toxic buildup and the damage caused to result to the stroke. Also, another disease group is pulmonary disease. That's sinusitis, bronchitis, pneumonia. For persons who have asthma, the cigarette smoke could be your trigger as well. And apart from these groups of disease states, there are other causes of concern, specifically for middle-aged women who are post-menopausal and at risk for osteoporosis. So osteoporosis is really like your density of your bones being decreased in its simplest form. When you're young and healthy, you have very healthy, dense bones that support your body. And as you get older, the density of these bones will decrease. But for postmenopausal women, the risk of osteoporosis is higher, and osteoporosis then leads to hip fractures. So you may have an aunt or a grandparent or a mother who when they get older, they may have had a hip surgery before. It's probably because of osteoporosis. What I am now saying is that cigarette smoke increases your risk of you having osteoporosis as a postmenopausal woman. I mean, who wants that risk? Who really wants that risk? Another issue that I want to talk about is poor wound healing. And that's going to carry me directly into the diabetics who are listening or watching this video. And if you have family members who are diabetic and also smoke, you want them to watch this video, especially this part. So as a diabetic, the sugar content in your blood inhibits the immune response for wound healing. So that's why, diabetics are cautioned for good foot care management and to avoid getting cut or getting any injuries, because your wound will heal slower than a healthy person. But get this, if you are diabetic who smokes, your wound heals even slower. Why? Because the plethora, the thousands of toxins that's in that white and brown stick, also cause or result in poor wound healing. Not only that, I want to touch on some of your medication. I cannot not speak on the effect of tobacco smoke on your medication. For a diabetic, as while I'm speaking to the diabetic population, if you are on insulin, do you know that tobacco smoke decreases the absorption of your insulin? So just imagine, doctor has prescribed 20 units in the morning, 10 units in the evening. And of that 30 units, just randomly say only 15 of the units actually being absorbed because you also smoke a pack of cigarettes a day. And that's the risk. So you might think, gosh, my sugar not going down on oral medication like metformin or diamicron or diaban, and I'm also on insulin, and no matter what I do, the sugar not going down. I want to ask you, are you a smoker? Did you let your doctors know? Because your cigarette smoke directly affects the absorption of your insulin, providing that you are on insulin. I also want to talk to the population that has high blood pressure, and you may be on a drug that is called a beta blocker. And beta blockers could be atenolol or Coreg. Probably these are familiar names to you if you are on either of them. And they're more, that's a beta blocker. Now, this falls on hypertension, falls on the cardiovascular disease. So you may have hypertension and you may have an irregular heartbeat, because it's also used for irregular heartbeats and regulating the heart rate, right? So whether it's hypertension or heart rate regulation you're using it for, you're on a beta blocker. What if I told you, if you're on a beta blocker and you're a smoker, the smoke is going to reduce the efficacy of the beta blocker. So it's going to reduce the effects of the tablet to manage your hypertension, but it's also going to reduce the effects of the tablet for normalizing your heart rate. So you have a heart condition. That's enough stress on your body. You've been prescribed medication that will work once used properly, but you also smoke. And that cigarette smoke is now preventing your medication from working. So I know you probably would have heard of food and drug interactions or drug and drug interactions. People always ask, could I use this with this? Is it safe? But not all the time do we consider what are the things we're using or chemicals we're introducing to our body outside of another tablet, right? Cigarette smoke would fall under a chemical that you're introducing outside of another tablet. So it's something that it's so important that you let your doctor know, and when you come to fill your prescription, you let your pharmacist know so they could counsel you accordingly. Last group that I want to touch on are those of you who are asthmatic. Now, you would realize I've done videos on hypertension, diabetes, and asthma previously, and that's why I kind of want to zone into these three big groups even in this video, because they are all connected. The blocks could be connected, from your risk for coronavirus to proper use of medication to you smoking. It could all be connected. For asthma patients, if you have been using an inhaled corticosteroid preparation, so for example, Bicotide or beclomethasone, which is your brown inhaler, that's a steroid inhaler. If you're using that, for instance, and you have asthma, and you may be wondering, okay, Dr. Tam, I take one puff twice daily. I've been doing that, and I'm still getting asthma attacks. It's not controlled, it's not managed. If you're a smoker, not only would the smoking itself could be a trigger for your asthma. But these toxins and the smoke could actually prevent the proper absorption of that inhaled steroid. So you puffing away thinking, oh gosh, medicine not working, or I need an original brand, or I need a different brand, or I need a next medication. When it could really be that the smoke toxins that you're inhaling into your body, it's preventing your medication from working. Guys, I'm always happy to share the information. This is literally me scratching the surface. There's so much more interactions between cigarette smoke and drugs, but I wanted to bring to you the most common ones, the ones that I think you're most familiar with. Thank you so much for spending this time with me, for listening to this video. If this information is going to benefit you, a family member, or a friend, please like, share, subscribe, and share this video. I have just given you the building blocks. Please go build a better you.